Okay, looks like we've got people joining here. We've got a little video to play while we kind of wait on everyone to. Okay, let's go ahead and get started. Parveen, looks like you'll need to pull up the presentation.
Yeah, sure, Ryan. So
Okay.
I think now everyone should be able to see my screen.
I'm not seeing your screen. Go ahead and do it one more time. It must have. Yeah, I don't think we're presenting your screen. Something's not working there.
Okay, just a second.
Okay, before we begin, I want to thank everybody for joining us today. So we're pretty excited about this webinar. And so we have Thomas Kalfas and his team presenting. And I want to give you a little bit of background about Tom. Tom is a life science professional of over 25 years. He's held positions on various industry committees to further the progress of data standards. He's helped to grow and enhance many biometrics and technical groups in the life sciences industry for his own companies as well as for clients. Tom's been with GCE since January of 2017, and he heads up the Innovation Solutions Group. And his role is to advance GCE's mission to support life sciences and the patients we serve by providing excellent and innovative service and software solutions. But before I turn things over to Tom, if you have questions that come up, type them into the chat throughout the webinar, and we'll answer your questions at the very end. And we'll kind of have a Q&A session at the very end of the webinar. So with that said, Tom, I'm going to hand things over to you. Tom, you may need to turn your mic on.
Oh, of course I knew that. Can you hear me now?
I can hear you now.
Yes.
All right, excellent. Okay, yeah, welcome everyone. Thank you for joining in. As Ryan said, we're excited to be able to continue our series on data and document anonymization. As Ryan also introduced me, I've been at GCE for this past year. It's been a very exciting year. We've been able to generate our entry into the data and document arena, anonymization arena. So you'll hear more about that towards the end of the presentation today. I've been able to assemble a very strong team here at GCE with the mission of producing innovative solutions, thus the name. So I'm very excited with the team and the capabilities that we have and what we've been able to achieve this past year. And once again, to be able to speak with you regarding the challenges of data and document anonymization today. So that's who we are, GCE, as many of you know already, but in the event that you do not know, we're a full-service CRO. I have been focused not so much on the operations side, but on the software, the solutions development side of the team. So once again, happy to be here with you today. Also with me today, and who will be leading most of the presentation, is Parveen Kumar. Parveen's been in the industry for over 15 years now, and has been one of my leaders in the group, focused on our group is a mixture of subject matter experts on the business subject matter expertise side. Parveen has been a senior biostatistician in the industry for a number of years. He has been focusing with me and Innovative Solutions on the business side, keeping an eye on industry trends, regulations around data and document de-identification. So Parveen is one of my go-to guys, and as mentioned, will be leading most of the presentation today. Also, to give proper due and credit, Neetu is another statistician here at GCE who helped contribute to today's presentation as well. So I want to give a shout out to Neetu. Okay, next slide. Okay, as I mentioned, this is part of a series of presentations, webinars that we've made available to our clients and attendees on data and document anonymization. The objectives are covering key topics of interest, of course, gathering feedback from the attendees on what we presented, as well as what is a key point of interest for them as they move forward to, as you move forward to address the challenges of data and document anonymization and de-identification. And also allowing to get feedback. Unfortunately, for today's presentation, we have so much to cover. Previously, we had been taking breaks during the presentation for poll questions. We're not going to do as much of that today. I think you'll just see one of those questions at the tail end, but we will be following up with you to get feedback through a survey via email. So we appreciate it in advance if you can contribute your thoughts and opinions on things in that survey, and we will summarize that for our next part of the series. Okay, we have done 2 presentations already, a primer and intro to data and document DID, and we took a deeper dive into document de-identification in part 2 of the series. Part 3 today is going to focus, it's going to revisit Policy 70 and specifically Phase 2 and the data de-identification side of things. So we'll have agenda, I think, coming up on the next slide. In regards to the webinar presentations that we made previously, we do have them recorded, so if you are interested, if you were not able to attend those and would like to get access to those recorded sessions, there will be a link that you could go to at the end of this presentation, or as part of the survey that you'll be able to request access to those presentations. For today's agenda, generally covering data sharing requirements in the industry, getting more into the EMA Policy 70 and Phase 2 and what the expectations are there as far as implementation requirements for Phase 2. We'll then get into data DID specifically, once again looking at some guidance documents that have been made available, looking at a prep checklist activity that you should consider before jumping into data de-identification methods and application of those methods. Then looking at direct and quasi identifiers and focusing on a sampling of standard DID methods that have been published and that we have made available through our data and document de-identification tool. And then a summary wrap-up. Okay, next slide. Okay, so at this point, Parveen, I'm going to go ahead and hand it over to you, and then I'll keep an eye on the chat room and questions that are coming through there. Okay?
Okay, yeah, thanks, Tom. Hello, everyone, and Good evening, good morning. So in today's webinar, we will be discussing around that what are the current data sharing requirements, then what guidance or documents from the associations, different non-profit organizations we have available, and then we will be focusing on the DID methods that are currently available and most of the industry is using, and what are their implications on the clinical trials data sets. So right now there is initiative taken by EMA that clinical trials data shall be shared with the general public as well as researchers, so that it could foster and improve the research that we are doing in drug development industry. So 2 years back, they have prepared a policy under which we need to submit clinical data in a de-identified mode, so that they could publish it on a on their website. Apart from that, there is association of clinical journals, ICMJE. So they have made a statement last year that anyone publishing in articles which abide to this organization, they need to make a data sharing statements at the start of any clinical trial, and or otherwise they will not publish the data from such clinical trials. And also there is a practice in industry that they are sharing their data on a daily on regular basis with general public, but they do not share it as such. They request for a proposal from a researcher or someone who wants to have access to that data sets, and then they review those proposals, and if it suits and they agree with the purpose of that request, then they share that data or documents with the requester. So we see here that there is already a data sharing that is ongoing in industry, and to share such data sets we need to be very careful because it contains personal information of subjects and patients that we enroll in trials. So focusing on EMA policy, so EMA policy 0070 will be implemented in 2 phases, where phase 1 is already implemented, and under phase 1 the MAH or the market authorization requester, they need to submit the clinical reports, and it comprises of module 2.5, 2.7 and 5 from ECTD format. Phase 2, which will be focusing on individual patient data, is yet to be implemented. So here we will be talking about that what we can expect from phase 2. So if we talk about the current submission requirements, then EMA is accepting the submissions of clinical trial data in ECTD format. So patient level data sets are rarely requested by EMA. So however, the individual patient data is already submitted to EMA in a form of listings, which is appendices to CSR. So what we can expect in phase 2 from the submission point of view, that we must need to de-identify patient level data listings that are as a appendix in CSR. And there is also a possibility that they may ask for derived and analysis data sets to be de-identified and submitted as a part of policy 70 phase 2. The reason for that could be that listings are generally in a PDF format, and it wouldn't be easy for researchers to use that data directly from a PDF. So they may ask for ready data sets to be available on their website for the researchers. Coming to data DID, so industry guidance right now, FUSE have made few standards available for de-identification of data sets, which is specifically for SDTM 3.2, following the standards from SDTM 3.2 implementation guide. And the other organization, Transcelerate, they have also developed some guidance around methods that should be used for de-identification of clinical trial datasets. So before starting on actual de-identification of datasets, there are few things that need to be considered uh, before actually moving to de-identification. So someone who is doing a de-identification of clinical trial data from a particular study, he needs to understand that what type of subjects have been recruited in a trial and their distribution geographically within the trial region. Also, that person needs to have an understanding that what is the possibility or what type of sensitive information is expected to be collected or observed as an event during trials, or any rare events that have been observed during trial. So we would be de-identifying this data after it has been collected and CSRs has been produced on this. So someone who have actually been involved in these studies or in that project need to sit together with a person who will be de-identifying and inform them of any rare event those has been observed during any of the trials. Also need to understand that what standards have been used for data sets that have been used for generating these listings, stratification factors used for randomization, key endpoints that have been considered for throughout the project or for particular studies to consider that what is specifically important from a data utility perspective, or any confounders for key endpoints. Those could be generally a demographic information, but if there are other confounders as well which we feel that could impact the key endpoints, then that shall also be considered. What will be the methods used for evaluating the risk of re-identification, and how will we be assessing the impact on data utility? Will it be based on a endpoint perspective, or will it be overall data, that how much data we have lost during de-identification, or we are primarily focused on only key endpoints that we shall be able to reproduce the analysis on particular endpoints? Then also other things which are supplementary to our de-identification is that anonymization plan or redaction proposal, that how to go ahead with that and what planning is required to do anonymization. So coming to data de-identification, that why do we actually need to de-identify data sets? So as I was mentioning earlier, that there is some personal information of subjects who have been involved in studies that is present in these data sets. And if someone is able to identify those subjects from the data sets, then it's a violation of personal data protection directive or law that is applicable all over the world with the different names of law. So all of us know that we can find some direct identifiers in data sets, which could be any variable which could directly lead to identification of a subject. So it could be subject IDs, not only subject, but also the investigators that have been involved or any other personnel being involved in a study. So it could be any ID, subject ID, investigator name. And there are other type of variables which are on their own are not able to identify a patient, but being linked to other variables or other quasi identifiers, they can lead to identification of a patient. So we see in this example that if we have a data set on the left side which is considered for sharing, then there is a possibility that the other general data sets or other information available on a public domain could be linked together to identify that patient. So if we have information from a voter registration, that gender, zip code, birth date, and name, then that information could be linked to this one to identify that, okay, this person, Bob Jones, had a broken arm and he can this information could be used further for someone's personal use. So coming to next slide, here we would be categorizing these variables in different groups. That what variables or which variables in clinical trial could be a direct identifier or quasi identifiers. So first is dates. It could be quasi identifier or direct identifier, both, because any particular event date or date of birth or date of death could lead to a identification of a patient. Then IDs or names, any IDs collected during uh, clinical trial. Then demographic information that we collect, like gender, age, race, ethnicity, country, or any personal information of the third party. So even the personal information of a third party could lead to an indication that where the trial has been conducted, in which area. So this could also be a quasi identifier. Then any free text variables could have a personal information, because while entering a comments or any verbatim terms in a adverse event datasets or medical history, sometimes the investigators note down some personal information about the patient. So we need to be careful in scrutinizing these free text variables. Then any sensitive diagnosis or rare events occurred during the trial. So these could be found in, like, in medical history dataset, conmeds, adverse events, or lab. So this sensitive information could be in any of the events datasets. So next we will move to that what methods we shall use to de-identify the variables within these groupings. So like for dates, we have date offset. So date offset is nothing but moving a date on a backward, or like subtracting a particular offset value of number of days from a date. So in this case, the dates will be replaced with a new date generated using a random offset for each participant. So one way is to do a random offset, but this offset is applied to all dates in the study for that particular patient. And the second way is to go by an algorithm, that we do not select a random offset, but we uh, put a starting day of a trial as an anchor date and decide that, okay, the first event occurred to a patient on a particular date will be subtracted from this starting day of trial, and whatever is the number of days between these two dates will be used as a offset. And then this will be set as an offset which will vary from trial participant to participant. So this is also need to be taken care that offset shall be performed by a participant, and not it is not as advisable that one offset value is used for all the participants in the study, because if someone is able to get a hold on offset value for one patient, it means he has hold on to all the dates within the trial. Then we have a second method, that is date relative. In this, what can be done is that the study day is calculated and replaced for the reference date. So study day, this is generally if you are following SDTM ADAM standards, then study day is already available in event datasets. So there we can just simply remove the variable and keep the study day. But if it is not there, then it is calculated for each observation as a number of days relative to reference date. So that way we remove the dates and keep the day, relative day. But it is preferable, as suggested by Fuse, that from a data utility perspective, it is better to keep both type of dates, absolute as well as relative. So in that case, we can do an offset for an actual date and keep the study days as it is. Then the most important variable considered to be quasi identifier is age or date of birth. So date of birth, it is generally suggested in policy 70 as well, that we shall redact or remove the month and day from a date of birth, and we shall only keep year. If age is not a quasi identifier, and we can live with the age as it is. Okay, moving to next slide. This is an example to illustrate that date offset algorithm. So if you see, this trial initiation date and trial completion date is there. So as per Fuse, we shall offset the dates in such a way that there is a no date beyond this trial period, that it shall be on or after trial initiation date, and any end date should be prior to trial completion date. So if we see that patient 1, the source dates were like this, that 10th Jan the trial started, and the first visit 0 date for the patient 1 was 18 Jan. So we see that the offset is of 8 days. So what we can do is we can set this 8 days as an offset and subtract it from all the dates that have been observed for that patient, and the dates will be offset. Similarly, for second patient, we will calculate a new offset value with if we see that this patient had visit 0, or the first visit occurred on 4th March. So this difference is of 53 days. So all the dates for this particular patient will be offset by 53 days. Okay, moving to next grouping of variables, IDs or names. So to de-identify IDs or names, there are 3 methods that we can use. One is pseudonyms. So pseudonym is nothing but assigning a random value, maintaining the format of the variable. Like if you have a unique subject ID as ABC-123, then it could be pseudonymized to FVE-432. So we maintain the format of that particular variable as it is, and replace it with the random values. And we have example for this one in the next slide. Recode would do is that it will assign a random numeric value to any of the ID ID variable, and this way we can recode any of the ID variables or any names or names variable. Then third method is shuffle. In shuffle, what we do is we will take out the unique values for under a particular variable, and we will shuffle them with another value, and no value will be same for any record after shuffling, but it will be consistent that if A has been shuffled with C, then everywhere A will be shuffled with C. So if we have like site ID and there are multiple patients within one site, so in that case, then we have a few things to be kept in mind, that direct identifiers generally do not have a data utility except for patient ID or sometime for site ID that we need it for our analysis. So if there is a no data utility for any of the ID variables, we can simply remove those ID variables or set them to blank. And pseudonyms is generally recommended to maintain the format of IDs and further replace them in CSR. So if we have subject ID, unique subject ID, and if we use pseudonyms, then it means that we will have the same format for each unique subject ID even after de-identifying it, and it will be easy to apply or make those de-identifications from datasets to documents. So pseudonyms is generally recommended for such variables. And there is one more thing that we need to or keep in mind, that whenever we are applying these 3 methods, if there are any ID variables which are linked to each other, like sometimes in SDTM datasets, Unique subject ID comprises of study ID, site ID, and then subject ID. So we see that it is a composition of 3 variables. So whenever we are shuffling, sorry, so we need to keep it in mind that we are shuffling all these 3 combined variables together. It should not be that one variable is shuffled, other one is recoded, and third one is pseudonymized. So this will break the link, or it will sorry, or it will lead to for any adversary, it will lead them to identify that, okay, these variables have been de-identified, and they can figure out that how these have been de-identified. So this is an example as we did it in our software shadow, that unique subject ID, study ID, and subject ID, these have been pseudonymized, and we see that study ID have been replaced with other alphanumeric values. Then same study ID have been used for U subject ID after de-identification, and then we see that subject ID 1002 have been replaced with 7785, and same has been implemented in unique subject ID. Next category is for demographic information. So this is biggest concern in clinical trials, that if we have a demographic information collected, and it could be a potential quasi identifier, and also if we have to use them for any analysis as a confounders, then it becomes very critical to judge that what will be the best way to de-identify these variables. So we have 3 methods. One is generalize, that if there is any continuous value or variable, then it will be it can be generalized to ranges. Or if there is any categorical value variable, then we can try to convert or generalize it to a broader categories. Like if we have a variable country, and it is it containing a information of that to which country a person belongs, then we can generalize it to continents. Or if we have age, and it could lead to re-identification, then we can generalize it to an interval of 5 frequency ranges, or if required, more than that, 10 interval of 10 in frequency ranges. Second way of de-identifying demographic information is aggregate, that if we have any continuous variable, then we can uh, uh, we have a continuous variable, and there are some extreme values on the lower side or upper side. Then we can select those extreme values and replace them with the aggregate or a mean of the whole variable. So this way we will be able to maintain the mean value of that variable. There will be shift in a standard deviation, but that way we will be able to de-identify the variable and also keep the mean values same as it were on the original data set. Then third way is to add a noise, that if we have like say if we have an age variable, we don't want to change it into categories or generalize it into a categories of interval 5, because it will turn it into a character variable. So what we can do is that we can de-identify age by assigning it any value in a range of 5 years or 10 years. So for example, if we have an actual age of 22, then we can de-identify it by replacing it with any random value between 17 to 27. Sorry. So this way we will be able to keep the variable as a continuous if it is required or needed for any particular analysis, and still de-identify it. So generally, as suggested by different organization of views, if age is not critical for analysis, then generalize age, and it is utmost required that any patient with over 89 years shall be generalized or aggregated, and there shall not be in any case a exact age of anyone who is above 89 years. And patient level demographic information such as sex, age, race, ethnicity can be confounders, so therefore could be critical for scientific utility. So this needs to be analyzed before doing any de-identification. So this is an example where age variable has been categorized to different ranges, 20 to 40. So in this we notice that the age variable has been blanked out, and new variable which is categorical in a format is created with all the ranges. Then also we have applied generalized method on a race, where we had few non-Asian categories, so we changed it into non-Asian and turn it into a broader category, and making it less unique for re-identification. Okay, so next is free text variable, sensitive data, or rare events. So how to handle these type of variables? So the most basic and general way is to get rid of that information from data sets, because this could be so unique that even that information that okay, in a particular region or particular male or female had this type of event in this or during this period, so it can be identified very easily. So it's best to get rid of these information from the data sets itself. So one way is to remove a variable, like for free text verbatim, those are no use for data utility. We use only the standardized variables or coded variables for our tabulation and other information. So any verbatim terms in adverse events or conmed could be removed, or we can blank those variables. Then cell suppression is any particular information within a variable that we feel is sensitive or is a rare event, then we can blank that particular cell in that variable and not the whole variable. Then third is redaction, that like in a comments variable, if we see that okay, the sentence is required, that or it's of no harm or it does not lead to, but a particular word in that or a particular group of words is not suitable, then we can redact that with some standard words or standard uh, group of words. So if critical to analysis and not recoded in the dataset, then review and only redact values with personal information. Otherwise it's always safe to remove particular variables. Remove variable is not preferable if datasets need to maintain the metadata similar to original datasets. So for example, if we have a dataset and we have a term, a verbatim term variable, and we want to keep all the variables as it is in a data set, so that when we run our macros it does not break down. So what we can do is we can keep the variable as it is and blank it out in place of removing it from the data sets. This is an example from the comments data set. Like if we feel that okay, a particular value qt prolonged is if collected or is being observed in any of the cell, then we can suppress it. Or if we want to redact any dates available in a comments, then we can replace that particular date with a redacted term. This is an example of in general, those were very particular to group of variables. Now here, this is a example where we have a complete, or I'll say that not very complete, but as most of the variables that are generally present in a data set, and how to apply different methods on a one data set and how it will look like. So if you see, center ID has been recoded, then investigator ID recoded, then there was an investigator name, so we have removed it. Then subject ID also recoded and then we have unique subject ID, which has also been pseudonymized. Then we have age, where we have separated it into two variables, age and age category. So then we have start date and end date for adverse events. Those have been offset. And then if there is any verbatim term as suggested, we can blank it out. So this is just to visualize that how de-identified data could look like. Okay, so coming to summary, that we understand that EMA phase 2 has yet to be implemented, but requirements for data de-identifications are building. Everyone is talking about it, and even the CSRs that have been submitted as a part of phase 1, sponsors are using data sets to de-identify their data sets and then implementing the same changes to their CSRs. So this thing is coming up, and it is now starting to be required for other purposes as well, like as discussed, that for journals as well, we need to make some data sharing statements. And also in general, there is an initiative all over the world, even in US, the people want to share their data sets, or general public want to see the clinical trial data sets to have confidence even in the regulatory decisions or research that is ongoing in drug development. Direct identifiers must be de-identified or removed from the data sets. Extent of de-identification depends on both like risk analysis and data utility, to ensure that the information safety and ability to reproduce analysis. So these are two topics which are very critical when we are de-identifying even data sets or documents. So we will be covering it in our further webinars. Risk of re-identification after de-identification should be null or below required threshold values. So EMA has suggested it to 0.09, and for other purposes, like if we are sharing it on a controlled platform with under some contract, confidentiality contract and all, there we can get or move this threshold value. But for EMA, for public disclosure, it is 0.09. So we have integrated de-identification tool Shadow that in GC we are using for creation and application of de-identification methods, assessment of risk of re-identification before and after DID, evaluation of impact of data utility, and flow of DID data into documents, that whatever de-identification we have done in data, if we want to implement it, the same in in a CSR for that study, then it should be very smooth. Auto generation of redaction proposals and anonymization reports. So these are also two critical parts while we are submitting our de-identification reports or data sets to EMA. So they want to check the de-identification done first in a redaction proposal and then in a final package. So you can visit our website if you need more information around Shadow, and we will be conducting further webinars and around risk of re-identification and data utility and how it impacts our decisions to de-identify particular variables or information in a documents. So these are the references that we have used while preparing this presentation. So thanks everyone. So Tom, you want to say something?
Sure. Yeah. Thank you very much, Parveen. We've had some good feedback, and actually we've been able to retain most of the attendees through the entire presentation, which is a challenge with as busy as we all are. So thank you very much for your attendance. We did get some good feedback in the chat room, and some questions that I responded to already. We're going to go ahead and summarize, identify those questions and the responses, and share that out with the attendee list as part of our follow-up survey communication. So once again, thank you very much. Ryan, I think you had, there were some issues with the beginning of the presentation with the video that was not playing for some people, so I'm not sure if we're going to end today's call with that video. Can you confirm?
Yeah, we can play it one more time at the very end. Let's go ahead and address everybody's questions, and then we'll play it right at the very end, just in case they hadn't seen it or it didn't play right.
Mm-hmm. Yeah. Okay. So as far as the there was a one of the attendees had mentioned another initiative out there for corereference.org, an initiative where they're looking to standardize, identify sections of a CSR for where sensitive information might exist or would typically exist. So that was a good comment. We'll summarize that and pass on information regarding that initiative. So there are several initiatives in the industry to help try to address the need of de-identification. There are other tools out in the market that are not free tools, but licensed tools. We have one as well called Shadow. That's an integrated solution for handling both data and document de-identification. So the power of some of these tools, as questions were asked, is that it is integrated, that it does allow for you to address data de-identification separate from document de-identification, but also an integrated approach where you could take de-identified data from the data sets and use that information to de-identify the values, replace values in the CSR, in the appendices. So that is something to look for as well. There are some questions there on lower level details for other types of de-identification methods that were not in the scope for the presentation today. We will comment on those separately. We do have plans for subsequent webinars based on the desire of the attendees. We typically will, as part of our follow-up questions or surveys, we'll provide a link where you can vote on the topic for upcoming sessions. So if we do find that we have a number of attendees who would like to focus on more of the granular level details of other types of de-identification methods, or perhaps have a more open forum where we can discuss ideas for de-identification methods that we have not covered, there will be an opportunity to do that as well. Okay, I'm scanning through here. Another question that we have coming is in regards to DID imaging data. And this is specific to GCE. So have we had requests to process imaging data? Not as of yet, but we do have through our tool the ability to support that. And again, I think was already mentioned, there's a link that's forthcoming that will be sent out. If you want to get more information on our specific tool and how we would be able to handle that for you, we can set up a separate call to go through that, to demo the product and go through your specific use cases. Okay. Outside of that, I think, Ryan, we've hit the other questions.
Okay, I'm going to go ahead and play this video and attempt to get everyone for it to work for everybody here. But this is just a quick video for our own in-house tool called Shadow. Okay, so that was our video, and again, that was our own in-house tool for de-identification and anonymization. One last thing, we do have a survey we would like everybody to take, just to kind of know how we did. We have some questions we would really appreciate you to give your input on. It's a real quick survey. I think it's 9 questions. So I'm going to have, at the end of this presentation, you should be redirected to take that survey, and we would really appreciate your input on that. We're going to wrap things up here and end the presentation. Thanks for taking time out of your day, everybody, and we really appreciate it. So have a good rest of your day. Oh, and one last thing, everyone should get a recording of today's presentation. So if you were curious about that, you will get a recording sent to your email. It'll probably be later today or tomorrow, but you will get that. Okay. And then you can go ahead and end the broadcast.
All right. Thanks, Ryan. Thanks, everyone, for your attendance today.
Yep.